Heart care tips. You might not give it much thought throughout the day, but your heart is working around the clock for you. Your heart is the most important muscle in your body because it pumps blood and oxygen to all of your organs. When your heart doesn't get the care it needs, serious problems can develop in the lining of the arteries, which then lead to plaque formation. Plaque is what leads to heart attacks and blockage of blood flow in the arteries. Understand the conditions that affect your heart and the habits that can help prevent or manage them. Taking action will help you keep your ticker in top shape. Heart disease. Cholesterol. What is cholesterol? You may think all cholesterol is bad, but your body needs some to work right. Cholesterol is a waxy substance that your body makes and you also get from food. It allows your body to make vitamin D and certain hormones, including estrogen in women and testosterone in men, and helps with digestion. Why should I care about cholesterol? There are two types of cholesterol you may have heard about: high-density lipoprotein or HDL, often called good cholesterol, and low-density lipoprotein or LDL, often called bad cholesterol. Bad cholesterol can contribute to artery clogging plaque. Good cholesterol, on the other hand, helps remove plaque. In the end, it helps protect you from getting heart disease. Having too much of the bad, or not enough of the good, can lead to heart disease. How do I know if I have high cholesterol? There are usually no symptoms of high cholesterol. That's why it's best to get your cholesterol levels checked through a blood test or home kits. You may need to go without eating, drinking, or taking medication, anywhere from 9 to 12 hours before your test. Talk to your doctor about how to best prep for a home test. That blood test will give you several numbers, including your total cholesterol, your levels of good and bad cholesterol, and triglycerides, which is a type of fat. How often should I have my cholesterol levels checked? If you are over the age of 20 and don't have heart disease, you should have your levels checked every 4 to 6 years. You may need to get your cholesterol checked more often if you're at risk for heart disease. Have high cholesterol, or have been on medications that treat high cholesterol. How can I lower my cholesterol levels? Medications and lifestyle changes can help you get high cholesterol under control. Even if you don't have high cholesterol, you can still make changes to your daily habits to lower your risk of heart disease. Here are steps you can take. Eat healthy. Your meals should be mostly fruits, vegetables, whole grains, low-fat dairy, poultry, fish, and nuts while limiting red meat and sugary foods and drinks. Bonus: eating a heart-healthy diet can help you lose weight, which may help lower your cholesterol. Move more. Aim for 30 minutes of heart-pumping activity most days of the week. Think brisk walking, bicycling, and swimming. Quit smoking. No matter how long you've been a smoker, you will still benefit from quitting. Avoid secondhand smoke. Even if you don't smoke, being around it can raise your risk of heart disease. High blood pressure. What is high blood pressure? When you have high blood pressure, also called hypertension, the force of blood against the walls of your arteries is high. Without treatment, high blood pressure can damage your arteries, heart, kidneys, and other organs. It can lead to heart attacks, strokes, and kidney failure. It can also cause vision and memory loss, erectile dysfunction, fluid in the lungs, chest pain, circulatory problems, and several other conditions. What are the symptoms of high blood pressure? You might have heard that high blood pressure is called a silent killer. That's because there may be no symptoms. How do I know if I have high blood pressure? A blood pressure test is the only way to know if your blood pressure is too high. During the test, a cuff is placed around your upper arm to measure the pressure of blood flowing through the arteries. While it's almost impossible to tell if you have high blood pressure without a test, there is something called hypertensive crisis, where your blood pressure is so high that you need emergency care. In this case, you would have symptoms. If you have high blood pressure along with severe headaches or back pain, chest discomfort, nausea or vomiting, feeling nervous or anxious, visual problems, or seizure, call 911. What do the numbers from a blood pressure test mean? There are two numbers in blood pressure readings. If one or both are too high, you could have high blood pressure. Systolic pressure is the top number. It tells you the pressure of blood flow on your arteries' walls when your heart is beating and pushing blood to your body. It's the higher of the two numbers. Diastolic pressure is the bottom number. It tells you the pressure on your arteries' walls between heartbeats, when your heart is relaxing and refilling with blood. How often should I have my blood pressure checked? If you don't have high blood pressure, you should have your pressure tested every 2 years after age 20. Your doctor will test it more often if you have or are at risk for high blood pressure. How can I lower my blood pressure? In some cases, making lifestyle changes can lower your blood pressure. Talk to your doctor to find out if you need prescription medication as well. Whether you're trying to prevent or treat high blood pressure, here are 9 habits you should follow. Eat healthy. Fill your plate with fruits, vegetables, whole grains, low-fat dairy, beans, skinless poultry, and lean meats and fatty fish like salmon, trout, and herring. Limit saturated and trans fats, salt, and added sugar. It is recommended to limit salt to 2,300 milligrams per day and 1,500 milligrams per day. For those who have high blood pressure or are at risk, African Americans, kidney disease, and those on medication for hypertension. Get active. If you have heart disease or any other health problem, talk with your doctor before you start exercising. If you're new to exercise or haven't exercised in a long time, start slowly, doing just a little bit at a time. Eventually, you want to do aerobic exercise, like running, biking, swimming, or brisk walking, for 30 minutes most days of the week. Watch your weight. If you're overweight, even just a small amount of weight loss, like losing 5% of your body weight, can improve your blood pressure. Manage stress. Stress can raise your blood pressure, so find ways to unwind. Exercising and getting enough sleep can help relieve tension. Or try taking 15 minutes of quiet time every day to relax. Leaning on friends and family for support and doing things you enjoy can also help you cope. Avoid tobacco smoke. If you smoke, quit. If you don't, secondhand smoke can still damage your heart, so avoid it as much as possible. Follow directions for prescription medications. If your systolic pressure is 140 or higher, or your diastolic pressure is 90 or higher, your doctor may prescribe medication. If so, make sure you take it exactly as directed. If you find this video useful, don't forget to like and subscribe to our channel.